Hello, my name is Justina Raducha and I'm a hypnotherapist and hypnoanalyst in Dublin. I want to talk to you about hypnosis and its use in treating many psychosomatic illnesses and habit removal. First of all, hypnosis is not a therapy. Rather, the therapy is being performed in hypnosis. Let me explain what hypnosis is then. Hypnosis is a natural, relaxing state of consciousness, a trance-like state that can be induced by certain procedures, but also happens spontaneously to each of us daily. Every time we get caught up in an interesting movie or a book or listening to music, so caught up that we focus all our attention on it, disregarding other things going on around us, we are in a trance state. Each time we drive a car or walk home from work and get so caught up in our thoughts that after a few minutes we don't remember the road we just took, we are in trance state. Every morning right after we wake up and every night right before we go to sleep, when we're in between asleep and awake, we are in a trance state. As you see, we are already familiar with being in hypnosis, although we're not aware that it has happened to us millions of times. Therefore, there is no question that every person of a sound mind can be hypnotized. All hypnosis is actually self-hypnosis, and it is an allowed state. The therapist is just a guide that can help you reach that relaxing state of mind, but it's up to you to follow his directions. I would like to emphasize that despite common belief, you are always in control of what you do or say while under hypnosis. Your control is actually greater than in regular day state, as your concentration is higher. What about stage hypnosis, you'll ask? It is very easy to explain what happens in entertainment setting. When going to a show, you expect people to perform a variety of crazy things. They want to experience it. They want to see what it feels like. It's a kind of a contract that's made between the entertainer and the audience the audience agrees to it, in this particular time and place. If you'd be the one asked to go on a stage, and believe me, the hypnotist chooses who he asks to the stage very carefully by picking only those people who really want to perform. While you're on that stage, you'd want to do a variety of crazy things. You'd want to experience it and see what it feels like. So you make an agreement with yourself to do what is expected of you. If the same requests to do silly things came to you at another time and place, guess what would happen? Absolutely nothing. Because you didn't agree to this, therefore you will not do it. Now, the contract between the therapist and the client is completely different. The person coming to see the therapist has a specific problem he needs help with. His motivation to get better, get healthy or free of habit brought him to the clinic. So he is willing. He wants to be hypnotized in order to get the therapy he needs. So under this contract, he wants to be hypnotized, and he will be hypnotized, providing he feels safe and comfortable with the therapist, and is not prejudiced or afraid of hypnosis. Again, the client is always in control, so if he doesn't want to be hypnotized, he will not be. Another myth about hypnosis is that you will be unconscious during the process and will not know what is going on around you. That is not true at all. Since you are always in control, you are completely aware of what is happening. You can hear the sounds in the room and on the street. Your feeling is more acute while you're in the trance, so you will even hear and sense everything better. There was a situation with a colleague of mine when a person in hypnosis made a comment about smelling the smoke during the session. The therapist didn't smell anything, so he just disregarded the comment and kept on going with the therapy. His client, however, said it again and just took himself out of hypnosis. In a few minutes, the therapist felt the smoke as well, and it turned out that there was a fire in the rubbish bin just outside the office. Hypnosis is a state of heightened awareness, as you see. But during clinical setting, we choose to concentrate that awareness on the inner self to facilitate the change that can heal the body and the mind. Sometimes people have fear of getting stuck in hypnosis. It is a natural state, almost like sleep. And have you ever fallen asleep and not waken up? While in hypnosis, you are always in control. If at any moment you feel uncomfortable, you just open your eyes and your attention shifts immediately from the inside to the outside, and you're out of the trance. There are times where you can be relaxed so deeply that you might fall asleep, but it's not a problem, as the subconscious never sleeps and always listens to the suggestions given to it. How do we know when we're in hypnosis? There is really no such thing as hypnotized feeling. There are many phenomena though, some visible, some only felt, that will indicate that the person entered trance state. One will definitely feel very relaxed and peaceful and may notice changes in the body, like feelings of warmth or cold in some parts of the body, tingling sensations, dissociation or floating feeling. From the onlooker's point of view, there is a great muscle relaxation and lethargic look. Person sinks into the chair or the couch. There can be a facial flush and the person's eyes start flickering and tearing. His swallowing reflex disappears, so you can see him swallow harder. In a deeper level, one can experience muscle rigidity when his hands will take a claw-like position. Don't expect to feel much more different than usual though. Most people after coming out of hypnosis say, "I didn't go under. I were not hypnotized at all. I was just laying there. I was relaxed and heard everything." Well, yes, that's exactly right. This is hypnosis. A natural, relaxed state of body and mind with heightened concentration and suggestibility and enhanced imagination ability. Now, how do we use hypnotic state in therapy? To understand that, you will need to know how the human mind works. There is a conscious mind and a subconscious mind. Conscious mind includes everything inside our awareness. This is the part that thinks and talks and rationalizes. It includes sensations, perceptions, memories, feelings, and fantasies inside our current awareness. Subconscious mind, on the other hand, is a reservoir of feelings, thoughts, urges, and memories we're not aware of. It takes care of our automatic functions as breathing, digestion, and heartbeat, and also things we've already learned and know how to do automatically, like walking, driving, reading, and much more. Subconscious mind also stores a lot of content that's unpleasant or unacceptable, such as feelings of pain, conflict, anxiety that influence our current behavior and experience, even though we're not aware of its existence. Subconscious mind is like the mind of a child. It takes things literally and doesn't reason. Most doctors agree that many of today's diseases have psychosomatic origins, meaning that they don't have physical causes but are created by the mind. They origin in blocked emotions or repressions, false belief about oneself and the world. The anxieties and fears, guilt or low self-esteem manifest as physical symptoms. It can be a rash that doesn't respond to medication, strong pain that cannot be relieved by pills, sinusitis, IBS, phobias or constant anxiety, and many, many more. In order to heal the body from these symptoms, we need to get to the reason why they happened. We need to get to the root of the problem, which is hidden in the subconscious mind. Hypnotherapy is a wonderful way of accessing that subconscious part of the mind. In the state of total relaxation, the conscious mind falls asleep, so it doesn't interfere with the release of that hidden material. Through the process of hypnoanalysis, we are able to reach forgotten memories and beliefs and bring them to light and understanding. They can be thought, felt, and released, bringing liberation from symptoms one could have suffered from for years. Hypnoanalysis takes between 8 and 12 sessions and is an amazing process that I would recommend for most people with anxiety and psychosomatic illnesses or phobias. There is also suggestion therapy, used mostly for habit removal like smoking cessation, weight reduction, nail biting, pre-exam nerves or self-esteem and performance issues. Suggestions have a way of reaching the subconscious mind in the hypnotic state, where they can be taken as true and believed, as like I said before, the subconscious mind doesn't reason, just takes things literally. Suggestion therapy is not a magic cure for all, as some believe. It is to be used with caution. Symptom removal would only result in symptom substitution. For example, we can suggest agoraphobic that he feels comfortable in open spaces, just to see that he will start feeling anxious in cars and elevators. Exploring the root of the problem is always the best option. The hypnotic suggestion has also a use in surgery as an alternate to anesthetics. There are cases of people that can't tolerate drugs due to weak heart or blood conditions, and using hypnotic anesthesia allows doctors to limit the use or amount of the chemicals. It also lowers recovery time, shortens hospital stay, and increases the level of patient's comfort. Although it's treated as some astonishing new technique, it's been around for centuries, but it has been forgotten due to invention of chemical anesthetics. I hope you now see hypnosis is a perfectly safe and natural technique that can help you heal uncomfortable symptoms, release all unnecessary habits and thought patterns, relieve stress, and get back the control of your life.